as always, sticking up for the consumer. Thank you. Next is Senator Bennet.
Thank you, Mr. Chairman. Can you hear me?
Yep.
Okay, I really appreciate it. Secretary Becerra, I want to thank you for joining us this morning, and it was great to see you in Denver a few weeks ago discussing the important topic of youth mental health, which I know is of great concern to both of us. I deeply appreciate your attention to that. And as you know, and I know you know, rising costs are a concern for many Coloradans and people across the country. We've got a real opportunity to do something this year on prescription drugs. You know, I believe very strongly that we should work to cap insulin at $35 a month. At the very least, we need to make sure we're not increasing costs at this time, which is why we need to extend the advanced premium tax credits that were expanded under the American Rescue Plan. In Colorado, 75% of people on the exchange are receiving financial help to make health insurance premiums more affordable this year as a result of these expanded credits. And if we don't extend them, Coloradans could lose $74 million in support for premiums for 2023. I've seen Congress do everything they can to extend tax cuts for the wealthiest people in the country and for the largest businesses. It seems to me that the least we could do is extend this support for middle and income and low income Americans. Secretary Becerra, could you highlight how important it is for Congress to extend these premium tax credits as soon as possible?
Senators, you know, there is a cliff that exists for those in the middle class to be able to afford health insurance coverage for their families. There is nothing like having a good quality health insurance plan to give you peace of mind to know that if you ever need it, your child can go to the hospital when necessary. You won't go bankrupt as a result. Extending these tax credits are indispensable in continuing the progress in getting more and more Americans covered. We saw an additional 20 million Americans get health insurance coverage under President Biden's plans, and we want to continue that progress because, as I said, there's nothing like having the peace of mind knowing that you can take your child or a loved one to the hospital when necessary.
But what and can you connect that to the tax credit extension?
Well, without the tax credit, many of these families, middle-class families that received affordable insurance coverage under the Affordable Care Act would not be able to hold it because it's too expensive. Yep. And it could be something as simple as getting a small raise in your salary from one month to the next, and that puts you over the top of what allows you to qualify for a tax credit. That's insane. That's the cliff that people fall over.
That is truly insane. And by the way, if you want to inspire people to work, we got to do away with these kind of cliffs. Just in the last couple of minutes I've left, Mr. Secretary, we spent a significant amount of time on mental and behavioral health in this committee, and I'm glad that the budget reflects the importance of addressing this issue as a crisis. The budget includes a number of proposals we're considering, including improving Medicaid, which would help the poorest and most vulnerable children and youth in this country. Could you talk a little bit about why we need to make strategic investments to address this mental and behavioral health crisis for young people in this country?
Senator, today, if you were to talk to families across the nation about mental health, about half of those who are parents would tell you that their children, they have had to think about taking their child in to get mental health services, about half. We have seen the numbers skyrocket for ER, emergency room visits by young adults and adolescents, especially among girls. It's a crisis, and we know it's somewhat under the table, but it's a crisis, and we need to start acting now. That's why the president makes substantial investments in this. I will tell you that the more help we have in making sure that we launch well the 988 national hotline number that will be used to help those who call, whether it's because of suicide or other mental stress. Anyone who's thinking about committing suicide, who takes the time to make a call and reaches out for help, should not receive a busy signal or be put on hold. 988 will launch in mid-July. We're putting together this network of detached providers that are out there right now in the country. We want to make it into one holistic approach. 988 should become the equivalent of 911 for mental health.
I agree with that, Mr. Secretary, and I will also say that in Colorado, we are having a mental health crisis among our young people, our adolescents that is unlike anything that we've faced before. Part of that is COVID, but it's lots of other forces that are tearing at our young people as well, and especially in rural places where there really is no access to services. This has become a huge chronic problem. Thank you, Mr. Secretary. Thank you, Mr. Chairman.
Thank you, Senator Bennet.